case you'd end up with one cell that has an extra chromosome 21, and one without. So one with 47 total chromosomes and one with 45. The cell with 45 chromosomes isn't able to survive, but the one with 47 does survive, and continues to replicate and produce more cells with 47 chromosomes. If this happens early on in development, then you can imagine that a lot of cells down the line can have 47 chromosomes, right? If it happens later on, then less cells will have 47 chromosomes. Mosaics can also happen when the zygote starts with trisomy 21, or 47 total chromosomes. In this case, non-disjunction would produce one cell with another extra chromosome 21. So this one has 4 chromosome 21s, totaling to 48 chromosomes. And this cell can't survive. The other cell, though, loses one of its 3 chromosome 21s. So now it only has 46 chromosomes, which happens to be the normal amount of chromosomes, right? And this is sort of like the opposite situation, because now, through a mistake, you've actually ended up with the right amount of chromosomes. So if it happens early on in development, you'll actually end up with more cells with the normal amount of chromosomes. If it's late in development, though, then less cells will have the normal 46 chromosomes. Having an extra chromosome 21 is one of the most common chromosomal disorders, and not surprisingly, it has an effect on almost every organ system in the body. And for that reason, there's a long list of common issues for those affected with Down syndrome. Here are some of the major ones: septal defects in the heart's chambers, usually between the 2 atria, duodenal atresia, increased risk of acute lymphoblastic leukemia, mental retardation and an increased risk of Alzheimer's, and sterility in males. There are several physical characteristics as well, like a simian crease in the hands, a gap between the first 2 toes, a flat facial profile, and epicanthal folds. Having an extra chromosome 21 is thought to affect these systems by an overexpression of genes on chromosome 21, since there's an extra copy contributing to gene expression, which changes the development of all the systems just listed. Now, a major risk factor for Down syndrome is maternal age, the age of the mother. Trisomy 21 happens about once in 1,500 births where the mother is younger than 20 years old, contrasted to about 1 in 25 births when the mother is older than 45 years old. During pregnancy, some screening tests can be done, and certain markers suggest higher risk that a baby might have Down syndrome. Alpha-fetoprotein, or AFP, unconjugated estriol, or UE3, are on average lower when compared to unaffected pregnancies, and human chorionic gonadotropin, or HCG, as well as inhibin A are both typically elevated compared to unaffected pregnancies. An imaging test using ultrasound can also be performed, where clinicians look for nuchal translucency. None of these are exact indicators of Down syndrome, however, but they do give valuable information about the overall risk of Down syndrome. Even though there's a long list of complications and hardships for people with Down syndrome, improved medical care has led to a much greater longevity and quality of life. Many individuals with Down syndrome are able to thrive and lead full lives. Thanks for watching. You can help support us by donating on Patreon, or subscribing to our channel, or telling your friends about us on social media.